Okay, we're going to go ahead and get started again. Thank you so much to people who have joined us today. My name is Alison Barkoff, and I lead the administration for community living. And let me start with a brief visual description for accessibility. I'm a middle-aged white woman with curly brown hair, wearing a black sweater, and I have a blue background with the ACL logo. Thank you all for attending today's webinar on the fall vaccination campaign and CDC's guidance, as well as information about the CDC Bridge Access Program that helps people without insurance access vaccines. We all know that the most powerful thing that any of us can do to protect ourselves and others this fall and as we head into winter is to get vaccinated and stay up to date. And this is particularly important for older adults and people with disabilities, including those who are immunocompromised, who are at much higher risk of serious outcomes if they get COVID. And this same group of people, which of course ACL cares a lot about, can also be particularly impacted by the flu. And as we'll hear a little bit more about today, older adults are also at higher risk from another respiratory disease called RSV. And that is why ACL is committed to making sure that the aging and disability networks are informed and prepared to continue to serve disabled people and older adults through community and in-home vaccination clinics across the country. Since the pandemic started, so many of you have been on the front lines, helping meet the needs of the aging and disability communities. And now, nearly 4 years later, you are continuing to still play a critical role in this work. Throughout the pandemic, ACL has been working with our aging and disability networks to ensure that all people who want a vaccine can get one. That means ensuring people have the information they need about the importance of vaccine, and also that together we are addressing any barriers. Building off an initiative that we launched with the CDC and the Disability and Aging Networks early in the initiative, ACL is now funding the Aging and Disability Vaccine Initiative. This initiative has more than 1,600 partners all across the country who are doing outreach and education, holding accessible vaccine clinics, and providing in-home vaccinations and supportive services like transportation. We also have launched and now expanded 2 national resources that can help disabled people and older adults find vaccines, including accessible vaccine sites or in-home vaccinations, and connect people with transportation and other supports they may need to get a vaccine. These are called the Elder Care Locator and the Disability Information and Access Line, or DIAL. And you can access these resources by phone, text, or through their websites. You can get information about this on the top of ACL's webpage, which is acl.gov. And of course, these resources not only assist with vaccines, but can help connect you with a range of other community resources. All of these efforts have been tremendously successful, especially around ensuring that older adults and people with disabilities can overcome any logistical challenges of getting vaccinated. So thank you, thank you, thank you for all of your continued work in ensuring, again, that every single person who is interested and willing can access these critical vaccinations. So let's turn to the real people you're here to hear today from, and that is our partners from the Centers for Disease Control. Today we have with us Dr. Nirav Shah, who serves as the Principal Deputy Director of the Centers for Disease Control and Prevention. Most recently, Dr. Shah served as the director of the Maine CDC, leading the state public health agency. And before that, he served in roles as the director of the Illinois Department of Public Health, as well as the president of the Association of State and Territorial Health Officials. After Dr. Shah, we'll hear from Dr. Amanda Cohn, Acting Principal Deputy Director at CDC's National Center for Immunization and Respiratory Diseases, who will talk about some of the guidance on fall vaccinations, as well as the Bridge Access Program. And then finally, we have a team of people from CDC who will answer questions that were submitted previously through our network partners. So with that, thank you again to our CDC partners, and I'll turn the floor over to Dr. Shah.
Well, great, and good afternoon, everyone. Alison, thank you so much to you and your team for your partnership and your support. And good afternoon, everyone. To encourage inclusivity, I am a middle-aged South Asian male. I have big glasses on, a light blue shirt, and I am standing in my office down in Atlanta right now. And I'd like to take a second to thank not just our colleagues at ACL, but all of you for taking some time out of your day to hear about where we stand going into or being in the midst of the fall and winter respiratory season, and what vaccination efforts are underway, what vaccines are available, and the steps that CDC is taking to make those vaccines as available as possible to everyone out there. I want to take a second at the top to first underscore something that Alison noted, which is that there are certain groups that we know are at higher risk of COVID-19, as well as other fall and winter respiratory viruses, like influenza and like RSV. All the more reason that we want to equip everyone on the call today with the latest information on all three of those vaccines, as well as the best ways to access them, especially if you are uninsured or underinsured. Specifically with respect to COVID vaccine, vaccines are for everyone, whether from a public health perspective or from an access perspective. And as we'll talk about, we want to ensure that insurance status or the lack of insurance does not present a barrier to anyone accessing their COVID-19 shot this fall. Speaking of which, I want to take a second to talk a little bit about the supply and the rollout of vaccines. As Alison mentioned, this year is a bit different. In prior years, especially with COVID, the ordering, the distribution, and in many cases, the administration of the vaccines was very much under the control of state health departments and the US government, local health departments, et cetera. This year, the vaccine, particularly COVID, is working its way through commercial channels. And we're aware that things have been bumpy. We've certainly heard from a lot of folks that they've gone to places and were told they had a vaccine appointment only to show up and learn that that appointment is canceled. Or they've called their doctor's office looking and waiting for when the vaccine was available and were told that they weren't sure. No doubt there have been challenges in getting the vaccine out as quickly as possible. However, every single day that passes, the situation gets better. When my team and I here at the CDC first became aware of many of these challenges, we sprung into action. We wanted to make sure that we were using our ability in public health to convene to try to understand what was happening, what the barriers were, and what we could do to try to lift those barriers and get the process moving. And we met with and continue to meet with every single player in the vaccine supply, whether that's manufacturers, distributors, doctors' offices, pediatricians, to try to understand what the potential roadblocks are. Thankfully, things are getting better, whether it's from an insurance coverage perspective or a vaccine distribution perspective. And the situation continues to get better with more and more and more vaccine out in the field every single day. I want to say that to acknowledge, though, that it's been a challenge, but also to ask you if you have signed up for a vaccine only to have your appointment canceled, or if you've been calling your doctor's office waiting to know when the vaccine was going to be available, please don't give up. There's not a crunch on the supply side. There is indeed quite a bit of vaccine that's being manufactured. Now it is working its way through the system. So please don't give up on vaccines. There is a vaccine out there with your name on it. What I'd like to do now is turn to the real reason why you're here, which is to learn about the vaccines that are available this year and how to best access them. And to kick us off in that discussion, there is perhaps no one better situated at CDC to lead that discussion than Dr. Amanda Cohn. As Alison mentioned, Dr. Cohn serves as the acting principal deputy director of the center at CDC that is focused on immunizations and respiratory diseases. But she comes to that role with a wide background. She previously worked in the division of birth defects and infant disorders within another section of the CDC. And since 2004 has served in various roles across the agency, including as the executive secretary of our independent body of experts, the ACIP, that helps us evaluate and make recommendations around vaccines. She was deeply involved with our COVID-19 work, and on top of all of that, she is a pediatrician as well as a fellow of the American Academy of Pediatrics. Again, not many people who are better situated at CDC to walk us through where things stand with respect to vaccines as well as access. So Dr. Cohn, I'd like to turn things over to you.
Thank you, Dr. Shah and Alison, for that amazing introduction and for setting the stage. I am Dr. Amanda Cohn. I'm going to provide a visual description of myself. I'm a white woman, middle-aged as well, wearing a black jacket. I'm in my office. I also have glasses on, and I have my hair in a ponytail. I'm going to provide you with the information today to help you understand which vaccines you and the communities you serve need, as well as the information on how to access COVID vaccines in particular, but really any of these vaccines as you are working through making sure both you and the populations you serve are vaccinated this respiratory season. Next slide. This season, there are more ways than ever to protect our health. For the first time ever, we have vaccines and other preventive antibodies that are available for all three major fall and winter respiratory viruses: influenza, COVID-19, and RSV. We have widely available and effective treatments for flu and COVID-19 that can reduce the risk of severe illness, hospitalization, and death. We also have rapid tests, some of which can be used at home, which can quickly detect viruses, so there are no delays in getting treatment and taking steps to protect family and coworkers. And we also have everyday actions, the same we've always had, such as covering coughs and sneezing, frequent hand washing, wearing masks, improving air quality, and staying home if you're sick to help prevent and reduce the spread of respiratory viruses. Next slide. But I'm going to focus today primarily on our respiratory virus vaccine program. CDC has the goal of protecting all Americans from influenza, COVID-19, and RSV. Importantly, though, we need to promote vaccine uptake among those who are at increased risk from severe outcomes from any of these diseases, which includes older adults in long-term care facility residents, people with underlying medical conditions, people with disabilities, and people who are pregnant. Our intent is to communicate rapidly evolving recommendations in ways that are understandable and accessible to everyone, and to implement equitably our vaccination program and uphold access for COVID-19 vaccines through this transition to commercialization. Next slide. So first, I'm going to start with some updates on these vaccine recommendations from the Advisory Committee on Immunization Practices, which has met several times over the last several months to talk through the best way to recommend these vaccines to protect the most number of Americans. Our COVID vaccine recommendations were updated in September 2023. We have an updated COVID-19 vaccine with a strain that is the most commonly circulating vaccine in our community right now, which is recommended for everyone ages 6 months and older, regardless of whether or not you've had previous vaccination or infection. This is the first year we've had vaccines and immunizations to protect against respiratory syncytial virus. In June 2023, RSV vaccine was recommended for adults ages 60 years and older using shared clinical decision-making. In August 2023, an RSV immunization was recommended for all infants under 8 months and some toddlers who are at increased risk for severe RSV. And in September 2023, RSV was recommended for seasonal use in pregnant people during 32 to 36 weeks gestation to prevent RSV in infants. And finally, we have our annual influenza recommendations, which have been really the way that we've protected ourselves from respiratory disease, respiratory viruses for many, many years. And all individuals ages 6 months and older are recommended to be vaccinated each year against influenza. Next slide. So I'll start with a little bit more information about COVID-19 vaccine recommendations. As I said before, the updated COVID-19 vaccines for 2023 to 2024 are monovalent vaccines. So they have one strain based on the most recently circulating strains of COVID-19, so that these vaccines will protect better than prior vaccines against the strains that are circulating now. We recommend everyone 6 months of age and older get a COVID vaccine. Next slide. So many of you, hopefully all of you and all of those in the community have been vaccinated already with prior COVID-19 vaccines. Regardless, everyone 5 years of age and older should get 1 dose of the updated vaccine to protect against serious illness from COVID-19. So even if you've never been vaccinated before, if you were not immunocompromised, you can get 1 dose and be up to date. For children ages 6 months to 4 years, they will still need multiple doses of COVID-19 vaccine, but one of those doses should be the updated vaccine that is now available. And people who are moderately or severely immunocompromised also need additional doses of updated COVID-19 vaccine if they haven't been vaccinated previously. At this point in time, we're saying that people who are moderately or severely immunocompromised who were previously vaccinated just need 1 dose of COVID-19 vaccine, but we're monitoring this closely and we may recommend another vaccine in the near future for those individuals, and they can get the additional doses. Next slide. ACIP also recommended this summer that adults ages 60 years and older may receive a single dose of RSV vaccine using shared clinical decision-making. Older adults at increased risk for severe disease from RSV include those with chronic medical conditions and those who are frail, such as those living in nursing homes and other long-term care facilities. We encourage you to talk to your healthcare provider about whether or not RSV is the right vaccine for you. At this time, older adults ages 60 years and older are recommended to get a single dose of RSV vaccine. And this vaccine has been shown to be very safe and effective and has huge potential to reduce respiratory disease among older adults this season. I know I am not talking to a population that I'm not talking to moms and babies, but I do want to mention, because we also have an incredible tool to protect babies from severe RSV illness this year. And all of us, if we don't have infants in our households, we certainly have family or friends who have infants in their households. We're all grandparents or parents or friends of individuals with babies. So we have 2 new tools to protect babies from severe RSV illness this year. We have a maternal RSV vaccine, which is recommended for pregnant people during 32 to 36 weeks gestation. And we also have nirsevimab, a long-acting monoclonal antibody for RSV prevention in infants. This works for infants 8 months or younger who were born during or entering their first RSV vaccine. But it's also really important to the children 8 to 19 months of age who are at increased risk of severe RSV disease, such as those children may have been born prematurely or have chronic lung disease or heart disease. If they're entering their second RSV season, they should also receive 1 dose of nirsevimab. This is really important to prevent the youngest of us from being protected from RSV this year. Most infants only need protection from either of these 2 options. And if you're pregnant, talk to your healthcare provider about which option is best for you and your baby to ensure you're protected against severe RSV illness. Next slide. Next slide. Finally, I want to talk about our influenza vaccination recommendations for this season. We recommend annual vaccination against influenza for all persons aged 6 months of age and older. But it is also true, as with RSV and COVID vaccines, that it is especially important for people at increased risk for severe disease, such as those with underlying medical conditions, those living with disabilities, and older adults, to make sure they're vaccinated by the end of October. This year, we recommend preferentially that people who are age 65 years and older get either a high-dose inactivated, recombinant, or adjuvanted inactivated influenza vaccine. So if you are age 65 years and older, make sure that you get the vaccine that is focused on making sure that you have a stronger immune response, so you can ask for the high-dose or adjuvanted vaccine. I'm going to switch to CDC efforts to address vaccination gaps, and this is very much focused on COVID-19 this season. So as Dr. Shah has alluded to, we have this season what is called the CDC Bridge Access Program. The Bridge Access Program provides no-cost COVID-19 vaccines to adults without health insurance and adults whose insurance does not cover all COVID-19 vaccine costs. All CDC recommended COVID-19 vaccines are included in the Bridge Access Program. No-cost COVID vaccines will be available through this program until December 31st, 2024. And the Vaccines for Adults program, which is proposed in the 2024 presidential budget, would be a long-term solution to ensure that all adults have access to recommended vaccines, including, but not limited to, COVID-19 vaccines at no cost to them. Next slide. So who can get the COVID-19 no-cost vaccines through the Bridge Access programs? This is available to adults age 18 years and older without health insurance. And I want to remind everybody that we have the Vaccines for Children program for children 18 years and younger without health insurance. So this is in addition to that program, as well as if you're an adult with healthcare insurance that does not cover all of your COVID-19 vaccines costs. The Bridge Access Program is designed to reduce patient barriers for COVID vaccines, and the burden of patient eligibility verification is on the healthcare system. It is not on you. So where can someone get no-cost COVID vaccines through the Bridge Access Program? There are 3 different ways that you can do this. We are leveraging our existing public health infrastructure through jurisdiction immunization awardees, our local health departments, and our HRSA health centers to provide no-cost vaccines to adults without insurance. Adults without insurance can get their vaccine from a local health provider or a HRSA, a federally qualified supported healthcare center that is enrolled in the 317 program, which I'll talk about in the next slide, and is participating in the Bridge Access Program. Members of the federally recognized tribes can also get no-cost COVID-19 vaccines at Indian Health Services, tribal or Indian health or urban Indian health programs and facilities, regardless of the enrollment status with CDC's Bridge Access Program. CDC has also established new contracts with CVS, Walgreens, and eTrue North pharmacies through existing contracts to provide vaccines at no cost at any of these retail pharmacies. Additionally, community events or pop-up sites with these groups may be available. We encourage everyone to visit www.vaccines.gov to find the provider closest to you that offers no-cost COVID-19 vaccines through this program. Next slide. This Bridge Access Program gets us one step closer to our vision of a fully funded immunization program across the lifespan. We have 2 existing programs and 1 proposed program to address these gaps in routine immunization. We have the 317 program and the Vaccines for Children program already help support access to vaccine. But in order to make sure that adults who are uninsured or underinsured can have access not only to COVID vaccines, but to all of our recommended vaccines, including RSV vaccine, influenza vaccine, as well as routine vaccines, we are proposing a Vaccines for Adult program. These programs will not only help with our routine immunization coverage to protect Americans from vaccine preventable diseases, but will also help strengthen our pandemic preparedness. Next slide. Data shows that only 20% of adults 19 years in age of older have received all of their recommended vaccines. And 24 million adults ages 19 to 64 years are uninsured. With infrastructure that was established through COVID-19, such as the Bridge Access Program, we're in a really unique position to launch a comprehensive Vaccines for Adult program. It would be modeled after the Vaccines for Children program, and we believe that this is a really critical step to having a comprehensive immunization program. By doing so, we would have a higher chance of getting all adults caught up with recommended vaccines. Next slide. I also want to talk about what we call the Partnering for Vaccine Equity program. We want to ensure older adults and persons with disabilities have access and understand the importance of getting vaccinated, regardless of the community in which they live in. We understand the critical need to address gaps in adult vaccination coverage, especially in racial and ethnic minority communities. We've seen great success engaging community-based organizations through this program, which was launched in 2020 to improve adult vaccination rates. The Partnering for Vaccine Equity program supports national, state, local, and community-level partners to prioritize equity in vaccine access and uptake for those groups that experience disparities in immunization. Through this program, we've administered almost 2 million COVID and influenza vaccines and reached more than 500,000 people. We offer comprehensive guides and resources through this program to help improve vaccine uptake in your communities. And you can find a link to some of those resources in this slide. Next slide. But in order to stop misinformation and the eroding trust in vaccines, we have to work with local partners and trusted messengers like you to improve confidence in vaccines among at-risk groups. And so we are really focusing on establishing partnerships to contain the spread of misinformation and to reach our critical stakeholders to provide critical information about vaccine and the role it plays in protecting the public. And that's one of the many reasons we are here speaking with you today. These elements work together to achieve the ultimate goal of increasing access and acceptance of vaccines to improve the health of all Americans. This is where you, our partners, come together, and we have a responsibility to make certain that people have timely, accurate, and easy to understand information about vaccines that they need this respiratory season and also for years to come. And so we are truly grateful for everything you have done to help us support the CDC and other HHS agencies in this effort. Next slide. And I'll end with where Dr. Shah started. As we strive to protect Americans from vaccine preventable diseases, we must redouble our efforts to make sure that all Americans are up to date on their recommendations based on their age and health conditions. It's important that Americans are vaccinated according to the schedule and across the lifespan. However, while we have vaccines that are recommended to protect all Americans this respiratory season, we especially want to make sure that people who are at higher risk of disease have access and the information they need to support their vaccination this season. I'll close by saying thank you. And I want to welcome my CDC colleagues, Dr. Shah and Dr. Eveline Twentyman, who will help answer questions. Thank you.
Thank you for that great presentation, Dr. Cohn. As we start to break apart some of the questions, we're just going to turn it over and ask the first one, who's eligible for the updated vaccine?
I'll take that first question. Everyone age 6 months and older is eligible for the updated vaccine. If you have had an adverse reaction to one of the mRNA vaccines in the past, we have Novavax, which is the protein-based vaccine that you can get. There is really nobody who should not have a COVID-19 vaccine who is age 6 months or older.
Thank you. If you've recently received a COVID vaccine or had COVID, should you get an updated vaccine?
The answer is yes. And then the second part of that question is when. And so if you've had a recent COVID vaccine or have had COVID, the infection itself, we recommend you wait about 8 weeks or 2 months before you get that updated vaccine. You can get it earlier, but in order to make sure you have the best immune response, we think about 8 weeks is the right amount of time to wait.
So with the updated vaccine, what are the potential side effects that someone may experience? And are they different from the initial vaccine given?
The side effects from these vaccines are actually very similar to the initial vaccines given. I think the one difference may be that they may not be causing quite as serious or severe fevers and pain. I know often when people first got their vaccines, they could have a day or two of minor but substantial effects on their on the way they feel. Because we've all been hopefully either vaccinated or had disease before, we already have circulating protection, and this is really a boost. But because our immune system has seen these vaccines previously, we tend to not respond quite as largely in terms of side effects with these vaccines. But it's the same side effects. You might have pain in your arm, you might be tired, or you might have a mild fever for a day or two.
Thank you. I know you touched on a little bit on this about frequency of how often someone should get a vaccine, but can you remind us of that?
So at this time, we're recommending that everyone who has previously been vaccinated get 1 dose of this updated COVID vaccine. We know that there may be a need for people who are severely immunocompromised to get additional doses. We are waiting to provide exact guidance on when those additional doses should happen. And it would not surprise me if people who are severely or moderately immunocompromised get an additional dose in about 6 months. But right now, everyone just needs 1 single dose.
Thank you. Now, there was a brief touch on the testing, home testing kits. Is there additional guidance or updated information around home testing?
We recommend that if you are feeling sick or you've been exposed to COVID-19, that home tests are still the easiest way to test yourself for COVID-19. If you have symptoms and you use so if an antigen home test, the tests that are used at home are called antigen tests. If that test is positive, then we trust that outcome of that, the result of that test, and you should consider yourself infected with COVID and take those steps to protect your family members from and loved ones from getting from spreading to them. If you test negative though, and you have symptoms of COVID-19, such as cough, sore throat, fever, achiness, any of these very general respiratory symptoms, you should test again in 48 hours, especially if you continue to have symptoms. Sometimes these antigen tests are negative at first and become positive a couple of days later, and that is occurring even more often in people who have been vaccinated multiple times or have had disease several times, if you need to know right away that if you are positive or negative, we recommend you get a PCR test, which you can still get at pharmacies and other locations. But if you're sick and you have a negative antigen test, we recommend you still stay away from people, you still mask and try to protect others from spreading respiratory illness, and test yourself again in 48 hours to make sure it's still negative. Dr. Shah, do you have anything to add to that?
I'll only add, Amanda, first, thank you for walking through that, because it's really important to know kind of what to do with a negative versus a positive. The other question that we've gotten a lot about lately is, hey, I've heard about all these new variants that are out there. Do the tests still work? Are they still good? And the answer is yes. CDC has worked with our colleagues at FDA, as well as the manufacturers of the test, to make sure that even with the variants that are circulating now, that the rapid antigen tests are still doing a good job of diagnosing COVID.
Thank you. Now we're going to move on to some questions that are more broader about the Bridge Access Program. One question that was submitted was, how can CBOs who serve smaller groups access vaccinations?
Thank you. I will start and then I'll ask any of my colleagues to jump in. The best way for CBOs to access the Bridge Access Program is through their local health department. Reach out to, hopefully over the last several years, you've either made contacts with your local or state health department and can use those contacts to identify ways to bring the Bridge Access Program to those groups that you serve. Evelyn, do you have any other additional thoughts for that?
Sure. Thanks, Amanda. I'll just add that community-based organizations also have potential partners in participating local pharmacies and local HRSA-supported health centers, as well as maybe some other local 317 enrolled providers. And that there are basically two big approaches to organizing events to increase access. One is to bring people in a community to a site offering vaccine, and the other is to bring a site to adults who need vaccine by setting up a pop-up vaccine clinic. And some of our participating pharmacies in the Bridge Access Program are doing just that.
Thank you. So some of our local communities have noted that with no federally qualified health centers or local health departments in some of the rural areas, they are having difficulty finding a close Bridge Access Program participant. Is CDC considering expansion of this program to other providers who have the capacity to possibly host community events?
So I'll start by saying that ensuring access in rural communities is especially important to us. And we totally understand that there are often people have to travel further to find vaccine, and we want to reduce that gap. There are more Bridge Access Program providers being onboarded every day, including pharmacies, health department clinics, and federally qualified health centers. So I encourage you, if you haven't found one close enough yet, to reach back out or to reach to your health department and say, we need a location near us. Can you help us? Can you help enroll? It is our local and state health departments that are enrolling the 317 healthcare providers in this program. We are strongly encouraging the pharmacies who are involved to have a vaccine available in all locations. But really, I think we are relying on our local health departments to fill in some of those gaps through their healthcare providers. Evelyn, do you have anything else to add?
Thanks, Amanda. I'll add just that vaccines.gov is a great resource to find participating pharmacies as well. And we are doing everything that we can to maximize proximity to free COVID-19 vaccine and to reduce barriers, including distance to COVID-19 vaccine. Thanks.
And more pharmacies are being enrolled every day.
Every day. If you're in a community that does not have a close by HRSA-supported health center, a CVS, a Walgreens, or other 317 enrolled provider, and you do have an independent or smaller pharmacy, we do encourage you to direct them to eTrue North to explore participation in the Bridge Access Program. And I'll put a relevant link in the chat for everyone.
That's really helpful. We are at time, but I wanted to close it out with one final question for the audience. What's the best way to connect with a Bridge Access program participating pharmacy to put on community events?
Even though that you jump in.
Sorry, go ahead.
No, I was
So I just threw in the chat one email and one website. We have 2 Bridge Access Program participating pharmacies who are specifically working towards setting up these community events. Those include Walgreens and eTrue North. And I've put an email for eTrue North in the chat and a website that contains a form to express your interest in a community event to Walgreens. These partners of ours are very eager to work with community-based organizations to get vaccine out there. Thank you.
And I'll just add that these, the nice thing about these pharmacies is that they can vaccinate people who have insurance as well as people who don't, if they put together these outreach vaccination clinics. So in many ways, that is a really good way to make sure everyone who you serve can get vaccinated and not having to split it out into 2 different approaches.
Thank you all so much for taking the time to answer questions from our network and provide resources. I'm sure these conversations will continue on. We will make sure to post this webinar on ACL's YouTube page in the coming weeks, and we appreciate you all for attending. Thank you, Dr. Cohn, Dr. Twentyman, and Dr. Shah so much.